only thing that worked. I would give it to him, and literally within 15 minutes, he was puppy-like again. I could see that he wasn't in pain, he wasn't panting, he was running up the stairs. So on Odie, I use Ease, which is a 550 milligram full spectrum CBD oil with frankincense essential oil, turmeric, and hemp oil. And it's great for arthritis, aches and pains, and allergies. No one likes to see their dog suffer. I know I didn't. And to be able to find an all-natural product that doesn't cause additional harm and helps them is a lifesaver for me, and it brings me so much peace of mind. CBD Dog Health,
Odie.
Healing naturally.
Oh, go Odie. Hello, everybody out there in the world. Thank you for joining us. My name is Carter Easler. I'm the Director of Education at CBD Dog Health. And today I am very excited to introduce you to a really wonderful vet. It's you, James. Hello. This is Dr. James St. Clair. James is the owner of a full-service small animal practice in Connecticut, the Meriden Veterinary Animal Hospital, right? Is that correct?
Yeah, Meriden Animal. Yes.
Yep, and he's also the founder of Top Dog Health and Rehabilitation, which is a progressive canine physical rehabilitation facility focused primarily on post-orthopedic surgery patients and older arthritic dogs. He is somebody who's really an expert in kind of what it is to manage this pain, both in older dogs and those who are in recovery. He has a lot of experience and is in touch with a lot of the research that's happening right now with different supplements and therapies that are going to be really helpful for dogs both now and in the future. And so today we're going to talk about some of the ways that we can both support our dogs that are already kind of in this place where they are suffering from joint pain and arthritis, and then also to prevent it, which is super important. Hello, Marianne. Hi, Terry. Hi, Sam Price from Canada. Welcome, everybody. If you have questions for us, please go ahead and post them there, and we will hopefully address all of them. Thank you so much for joining us.
Yeah.
What's up, James?
What's up, Carter? How you doing?
How you doing? Dr. James. Do you prefer Dr. James?
No,
Dr.
I prefer
St.
James.
Clair?
No, James.
Is James okay?
Yes.
Okay, cool.
Yeah, no, I'm excited to talk about this topic. You know that I have a lot of passion around the world of management of arthritis. I've done a lot of writing about it, and built a company, around it. For me, Carter, it all started when I had a rehab facility. I got out of vet school, and it was the world of canine rehabilitation was just starting to pop and blossom. You found it in a couple of the universities, and then I came back to Connecticut. There was one individual who was a human physical therapist that had a facility here and was doing rehab, and it made sense to me. I'm like, these, our friends need these services. So we had a 2,400 square foot facility. We had an indoor pool. We had the underwater treadmill. We were doing laser therapy, and it was awesome. And I was constantly trying to prove myself to the surrounding veterinarians. Hey guys, look, this non-invasive, good thing, works. It helps. Your clients love it. You should be talking about it and recommending it. And, it takes a long time for people to change their ways. But I ended up, for me, realizing that at the end of the day, Carter, the only ones that really mattered was not trying to change the minds of my colleagues. It was just trying to help the ones that I really wanted to help were the parents and the animals, right? So the focus switched to how can I help and educate parents so that they can just be more informed parents, right? That's the goal.
Absolutely. What we always say is, once you know better, you do better. And just beginning to plant those seeds around really does make the difference. And, you know, word of mouth travels. We have seen so much change, positive change in how people are, you know, working with their animals. And at the same time, there's a lot of bad information out there at the same, more than ever. So, you know, we've gone in opposite directions kind of in many ways, but, you know, there are more people asking their vets and coming to their vets, and luckily there are more vets as well, like yourself, who are kind of on board with this and can speak to these alternatives.
And we have like pet parents that are actively going out there and getting information this way, right?
Yeah.
From trusted experts, people that care, right? And getting their own information, which is critical.
Yep.
You got a question already. That's a big question.
Hi, Marianne. Marianne says, my senior dog has some back leg stiffness and occasional problems with cognitive communication to the joint, specifically after he's been resting. Sees a chiropractor, receives bi-weekly acupuncture and water treadmill therapy along with laser treatment. Wow, he's getting it. Is there anything I can do for him? He doesn't appear to be in pain, but I know dogs hide pain. I have used ease, but not consistently. Is that something I should use daily? Absolutely. Consistency. If you're going to be using a hemp extract, something like ease, you are going to get the greatest effects when you're using it consistently. Because, you know, when you're using it just acutely in those situations, just in the moment where you see a lot of pain, you're getting some of the benefits, but not all of the most important benefits. So especially if your dog has these neurological issues, you know, that is something that is not going to be repaired without consistent use. So I would absolutely be using it consistently. And, you know, with how many different things you have going on, and you know, with a senior dog as well, you may also need a higher dose than what you're currently giving. So I would, anything else you'd recommend?
Yeah, I have a lot.
I'm glad you're here. I'm glad you're here for this talk, because we're going to go through a lot of different things. So we'll get back to you on that.
Let's table that just for a little bit.
Yeah. We don't want to give away all the answers right at the beginning, and everybody's just going to sign off. So why can we just like set some like talk about like what we're trying to prevent and what really we're talking about when we talk about joint pain, arthritis, dysplasia? What is actually physiologically happening that is leading to our animals being in pain and losing mobility? I see some little joint dioramas in the background there that I realized. Can you get the demo?
I got good joints. So look, I mean, I think the most important thing is we keep it super granular and simple, right? In the grand scheme of things. So however you get to an injury to that joint, whether it's through like the dog hyperextending and blowing its ACL and then requiring surgery, or genetically, right? The dog, Carter and I were talking, before we just got on, the number one dog breed that actually has dysplasia. It was, and I found this on in the United States, there's the OFA, so the Orthopedic Foundation for Animals, and they've been tracking since 1974, trends inside of breeds around joint disease. Pugs, 72% of pugs had dysplasia. That's a tremendous number. So whether it's genetics, injury, poor nutrition, that creates a really inflamed body, however it is, essentially at the end of the day, let's just kind of break down the basics of what happens, right? So this is our knee. It has a kneecap that fell off. The kneecap goes there, okay, like this. I think we can see that. So if I peel the kneecap or the patella bone of the knee off of there, we have this nice white substance here. This is our cartilage, right? And then if I just lean this back, you can see inside, right about there, that there's this kind of cream colored padding. So that's called the meniscus. It's essentially like a little pillow that the femur sits on, the top of the tibia. So around this entire thing is a capsule, right? And that capsule then contains the fluid that is inside of the joint. So this particular joint is referred to as a synovial joint, right? So it has synovial fluid inside of it. That's very different than like, the articulations in the back, right? These are not synovial joints. So this is a synovial joint. So what happens is some trauma or injury, whatever it is, causes some disruption of homeostasis inside. These are they're really referred to as dynamic structures, right? Because they're constantly changing. They're constantly the joint fluid is constantly being replaced. The joint capsule is constantly being nourished. It's a live structure, right?
Yeah, right.
So when that gets disrupted, right, it forms inflammation, right? So we see inside of this joint, now there's inflammation. That inflammation ends up disrupting the joint fluid. The joint fluid is not as viscous and sticky as it once was. It becomes thinner, which makes this not quite as, I always think about like, would you rather run in a flip-flop or a pair of Nike running shoes, right? That have a nice thick sole. You want Nike running shoes, right?
Yeah.
That's a no-brainer. So the thicker the fluid, the better it is. Over time, what ends up happening is you form what are called osteophytes, right? So you have these little like bony fixes that the body tries to lay down new cartilage, and it starts to get just not as smooth and comfortable, and so that then continues to roll the ball. That roughness leads to more inflammation. That more inflammation leads to more disruption inside of the joint. In the process, it's a ball on the top of a hill just rolling down, right?
Yeah.
So to the point that, eventually, they get to the point where they start experiencing pain. So look, somewhere in my 30s, right, I'm a big skier. And somewhere in my 30s, I would come off of the hill. We live on the East Coast, so we refer to them as hills, not really mountains, right?
They're not mountains.
So I come off and my knees would be hot and swollen and painful, right? So what would I do? I would take an anti-inflammatory. I would ice my knees, right? I would do these things to reduce the inflammation. Reactive versus proactive, right?
Right.
I was reacting versus actively going and saying, oh, maybe there's actually a problem going on here and I need to, get in front of this. So does that answer your question, Ish?
I think so. Yeah, that absolutely does. And that, this is so in line with kind of everything, our philosophy surrounding kind of all health and wellness is, to act proactively is so much more effective than to act reactively. Because, oftentimes if we're already seeing our dogs showing signs of discomfort and pain, there's already been a long time where this has been an issue that we weren't even able to kind of perceive that it was a problem. Right. And, this is something that you mentioned when we spoke, is like being able to start to recognize the signs that we don't even see as signs of this kind of inflammation and eventual damage happening. Right. So can you kind of talk about that a little bit?
Yeah. So I was just going to look for this little book thing. So on to that note, Marianne had said, I'm not sure. She made some comments on whether or not it didn't seem that he doesn't appear to be in pain, right? So let's just talk about that.
Yeah.
So when I was actively doing physical therapy or canine rehab, and I had a facility, I had a couple of rehab practitioners that were working for me. Patients would come in and I would get in open conversation with them about pain and the perception of pain.
Mm-hmm.
And I would ask them, do you think your dog is in pain? And 90% of them would always say no. So then I would ask the follow-up question, why do you think your dog's not in pain? And their answer would be because they're not crying or whining. So I started to dig more into that. It became like a bit of a frustration for me. Why is it that people can't see what I see, right?
Yeah.
The dog would not be using the leg, would not be bearing weight on the leg. And you couldn't put two and two together that the dog's not using it because it's in pain.
Yeah.
It was like, it was just a lot. So the word came down to anthropomorphism, right? Anthropomorphism.
They're not showing it. What is it? Anthro meaning human, pomorphism meaning act like human.
It is. We are injecting essentially human characteristics onto inanimate objects or other living creatures. It's like going outside and thinking that, you know, the squirrel is talking to you, kind of a thing. We see our kiddos, our children, these four-legged children, as if they are humans, right? That's what we do. They're our babies. And so when we are in pain, what do? We complain. We talk about it all the time because we get some kind of relief from expressing and you saying, oh, I'm so sorry that you're in pain. It makes me feel better. But our animals don't do it that way, you know?
Right. No. Oftentimes the opposite. They're biologically wired to hide it and to disguise it until the very last moment until they can't anymore. Didn't you write a book about this? I did. You have a book about this.
It was called Dogs Don't Cry. It's free on Amazon. Anybody can read it. So we're going to cover the main topics, you know, inside of it. But look, sadly, I always use the example, a dog that gets sadly hit by a car will cry in pain for a very short period of time until they bring that in. If the pain is super acute, they will talk about it. It's rare. And there are dogs that actually will use vocalization as one way of expressing themselves, but the vast majority of them unfortunately don't. So I want to cover those. I want to cover these topics. So obviously the pain point for me was, why do people not see pain? And how do I, one, what are the signs of pain? And how do I get that through to parents so that they can start to identify these, I refer to them as silent signs. How do we identify the silent signs? So do you want to jump in and talk about those?
Sure, absolutely. I mean, you know, so we've got this list of 12 silent signs. And so the first one on that is just slowing down. And, you know, this is something that, you know, we see over and over again, that people come to us and, you know, we'll ask questions of like, you know, I used to take my dog on a 30-minute walk, and by, you know, we get halfway around our loop and he can't go back anymore. And I'm dragging him the whole way back. It's that he's reluctant to keep going. That may not look like a sign of pain, but that is his way of saying, I'm going to prevent myself from being in pain by doing this, instead of crying out. So changes in the routine, you know, slowing down. Behavioral changes, you know. So slowing down, you also have to think about this, Carter, is like we make this association with aging, right? As in, oh, my dog's just getting older. So because they're getting older, they're slowing down, right? When age is not a disease, right? That there are plenty of 15-year-old dogs who are running around feeling great,
right? So it's age is not the issue. It's not the how we I think it's just how we end up telling ourselves so that we understand. But slowing down is probably, you know, the number one. Slow to get up or slow to go down. There are dogs, they're laying down. You watch them go to get up, right? It's like, it looks like there's a little bit of extra effort going on here. Or when they go to sit down, some of them will plunk, right?
Yeah.
As opposed to gently lowering themselves, they'll just go bloop, you know? And so that plunking behavior. I love this one, avoiding to go upstairs.
Right. That was what we had in that video that we showed right at the beginning of Odie, Angela's dog Odie, who was kind of the reason that she got into the cannabis world. That was one of the first signs that he was developing that arthritis, you know, at age 11. You know, and he he used to run up the stairs, he would stop halfway. Or would just take his time, and it would, you know, it becomes more labored. It's not the leap, it's like one at a time.
There was actually two signs in that he was also bunny hopping his way up. Now he has shorter legs, so sometimes they have to bunny hop, but bunny hopping up the stairs can be a really good indicator. Sometimes the dog will literally sit at the bottom of the stairs and look up and like have to muster up the energy. They'll pause and they'll be like, oh crap, that looks like I can do this. I'm going to do it. And then, you know, they'll make their way.
You're anthropomorphizing, James.
Avoiding jumping into the car, right? So dogs, there's a lot of dogs that in and out of the car. Oh, my dog just can't get in the car anymore, so I have to help him up. It's like, there's a reason for that, right? Let's just ask ourselves, is there possibly a bigger reason on why that behavior stopped? I was going to say another one, sleeping more. So this goes along with age, right? As dogs age, oh, my dog's just getting older, so they're sleeping more. Well, how about possibly considering when they're up and moving around, it's actually uncomfortable. So they're more comfortable when they're sleeping. What happens when that happens? What happens when the dog lays around more and starts sleeping more?
More
if you don't use
stiffness,
it,
less activity.
You lose it. And you start to lose muscle mass. We forget that this is a muscle skeletal system, right? So part of the game is keeping them moving so that their muscles do not atrophy over time. If I have I'll use an example. You could have like a Staffordshire Terrier, a pit bull, right? Horrid hips underneath. They actually, I forgot what their number was. I found it. It was fairly high in the grand scheme of their percentage of genetic dysplasia. But you could have those dogs. You wouldn't necessarily see it because they have such incredible muscles supporting around, you know, when you look at that pitty leg, right? They got massive quads, big glutes, huge hamstrings. So they can get away with it a little bit more because that muscle is helping them out. So, and then the last two I just wanted to bring up was closed hind leg stance. This is a classic one. Dogs will walk, stop, and then they will bring their legs closer together in order to almost like teeter on the back legs as one and not two back legs. Instead of standing in a proper stance, they bring them closer together, and then you'll see the weight shift to the front because they have four legs. We don't get away with it because we have two, but they have four. So they displace some of it to their back and some of it to their front end. And then the last is just the wide front leg stance.
Absolutely.
There's a couple more. Sorry. I just saw them.
Please.
Joint licking. Joint licking. Shaking or trembling, right? To the legs, like having this little bit of a quiver going on. Something like aggression. Sometimes dogs, if they don't feel well, will show aggression because they just don't feel well. There's plenty of people that are dealing with chronic pain that experience that same outlay, of expression. So those are the main ones.
Yeah, I mean that there are a lot of those in there that I think we normally wouldn't associate and try and follow the dots from that to joint pain and and also to your point, it is so, it's really important not to just kind of accept a lot of these things as a natural progression of age, and that that if these signs are happening, to just accept it and say, okay, that's just them getting older, that is a sign that you're still in a phase as it's starting where you can do something about it, and that you can still act you're not out of the proactive phase yet, where you can, prevent further deterioration. Because that is still, we don't want it to happen at all, but at each sequential stage, it gets less and less possible that you're going to be able to have long-term preventative effects on this. Am I right?
Big time. Yeah, big time.
Yeah.
And one other point I think around that is, I think that pet parents need to understand that in order for me to do my job the best that I possibly can, I need them to come in and talk to me about these things, to see these things, right? So one of the challenges is that they rely on the veterinarians to do this. And I have a couple big problems with that, Carter. It is, and I love my veterinary professional colleagues, right? This is not against them. It's, we can't uncover everything in the time that we have, that we spend with the animals, right? Think about this. Number one, we're in a small room. I don't get to see them moving around, getting in and out of the car, going upstairs, and getting up and down.
You're not going on a walk with them that lasts 20, 30 minutes. You get 10 minutes with them.
10 minutes, 15, 20 minutes, if, and I know there's extraordinary veterinarians that spend hour, like a lot of the integrative community spends a lot of time, which is amazing that they are built that way, but the most people are not built that way. Think of white coat syndrome. Think about that animal going into the animal hospital and being like, what you talking about, Willis? I'm feeling great. Like, I'm out of here, right? They are doped on adrenaline and they are ready to go. So a lot of times, even if they're doing a good orthopedic exam, they won't necessarily pick up on some of the subtle signs. One of my favorite signs, Carter, one of my favorite signs was taught to me from a dog trainer. It was a sign of submission. So in this dog training, the response was, I correct you, you give me a sign of submission back, and then I reward you on that submission. So there was two ways that you identified submission. Either the dog's ears would go back, I'm mad at you, and their ears go back, and then you reward them on submission. But the better sign was that the dog would actually do this.
The licking?
It would do this little licking behavior. It is foolproof. When I do my orthopedic exams, I watch for that dog's reaction. If I put you into hip extension, the dog, some dogs might turn around, try to bite you. Some dogs might just stand there still. And then when you're done, they will go lick, lick, lick. And it's like, please don't do that again. Please don't do that again. So if you notice, for the parents, if you notice when you, let's say you're hanging out with your dog and you're just manipulating them and they do that, that might be a sign that they're uncomfortable in that particular joint or,
Right. And I want to just take this opportunity. Aaron just posted a link to your website, Top Dog Health, and the article 12 most common signs pet owners should know to determine if their dog has joint health problems. So it's kind of what we're talking about here. And your website has a lot of really great kind of guides to rehab. There's a lot of really great educational information on there. So is this someplace that they can find, some of these, like you're talking about these extensions that you're doing, is this someplace where they can kind of, this is going to be able to show them kind of what to look for and what those the things that their dog should be able to do and what the signs are when they're practicing these?
That's great. No, but I'm going to add that because that was brilliant.
Well, you're welcome for the idea, and I would like some credit.
Add that because that is brilliant. No, I mean, they can find videos on different physical therapy exercises and techniques, right? The problem, Carter, that I always had was that I really just wanted to help the parents help their animals, right? And it's like, for example, Marianne, I'm going to go back to Marianne. Marianne said, my dog is getting laser therapy. So right now, we are doing a clinical study on a cold laser therapy device. And so traditionally in the world of cold laser therapy, there are different classes that these lasers come in, right? So they're up from a class 1 to a class 4. And that all has to do with the concentration and intensity of that laser. When you start to get up into the higher classes of laser, you're just delivering more energy in a shorter period of time. But you have to go to a veterinary professional to get that. So we're doing a trial on a home laser device that is a class 1 device. So that this is something that parents could utilize at home on a more consistent basis. So it's just that the therapy takes longer, but the device is safe for use at home. For
the people at home who aren't familiar with cold laser therapy, what it's doing is essentially increasing circulation and reducing inflammation to the tissue around a joint, for instance, right?
Yes, it is adding energy back, and on a very organic level, the mitochondria in the cell are producing more ATP, and they are sending out signals. Hey, buddy, come back over here and help me figure this out. Because a lot of times when something becomes chronic, your body's like, yeah, I've heard that before. Like, whatever. Okay, I got other issues that I'm working on. So you're just asking the body, come back and help me out here. Bring
it back to homeostasis.
Bring it back to homeostasis. So with this particular cold therapy device, the dogs that were using it for arthritis, it's been amazing. I did a dog. Have you ever heard of a lick granuloma? Okay, so like dogs will form these chronic skin lesions. So this particular, they'll sit there and they'll lick and lick and lick. They'll turn that into this, like, you know how like when you have a chronic wound, it starts to get itchy? Right? Because it's in this phase, of inflammation. It's trying to heal, but you keep messing it up. So this particular dog, we were trying to use it for a skin lesion. The dog dramatically changed in its mobility because it was licking because its carpus was hurting it. Right. So not only were we healing the skin, but we were actually helping that joint and the dog's comfort level. So, there's a lot of amazing, innovative new therapies that are coming out that are helping these guys.
And all of this is kind of goes back to kind of the idea that the pet parent has to be proactive and has to be have an active awareness of what is going on. It's going to take so long for vet to put this together in that short amount of time that they have. So learning to look for these signs and really be aware and anticipate them to, go back to that list that we kind of talked about of the different breeds that may have a genetic predisposition, and know that this is something that, the pugs, the bulldogs, the Brussels Griffons, St. Bernards, Rotties, German Shepherds, Golden Retrievers, who are genetically predisposed to this, just to kind of expect it and know that there are things that you can do before it even becomes a problem to start addressing these things. And then when these signs do come up, like what are in this blog listed here, then you'll be more acutely aware to see them and have them not be a surprise.
Yep, for sure.
Yeah, cool. I mean, I think one thing that, we always have to talk about is, one of the ways that we can really kind of prevent all these things from happening is to support their diet, to start with nutrition, and start with the ways that the body is going to naturally have the building blocks to produce the necessary materials for these joints to stay healthy, and then also to have what is necessary for the body's kind of communication pathways to regulate itself and regulate the inflammatory response. That, and one of the primary reasons that cannabis-based therapies like CBD are so good for this are because that is one of the primary ways that it affects the body, by increasing communication between the various systems, reducing inflammation. Wait, I have a little thing. I have a little graphic. Reducing inflammation, modulating the immune system and the inflammatory response, and then also diminishing the perception of pain on kind of a more symptomatic level. Right. Something like this. Yeah, go ahead.
No, so what I was just going to say on that, because we had talked about this, like I'd asked you on our last interview, like I had asked you about in the world of CBDs, like or the full spectrum hemp, in utilizing them in pain management, at what point in time do I, as a parent, or me as a clinician, start to bring and introduce these into my patient's therapy, right? So later on, we were going to start talking about kind of the long-term management of joint health, right? And where that all ends up playing in the concept of tweaking it and as they go along in their life, because it's a degenerative process. So it's progressive. So it's always progressing. So to that point, like in the use of CBDs, we're going to use those more towards when we are visibly seeing signs of pain or difficulty around their function, right?
Yeah.
So that we're going to do this to improve their comfort.
Yes, and to prevent prevent damage when we get into those inflammatory states. So like you're saying, there are those times where you may not have an animal that is chronically arthritic. You're like with your skiing kind of anecdote. Maybe your dog just was skiing and has sore joints just from that, but otherwise is pretty good. Those are the moments where you're going to start causing the damage, where you have that inflammation. So you've got that extra rub. The body has the impetus to create more cartilage, and then you have more rub. So it's those instances where it can be a really good idea to, at that moment, fight the inflammation by giving them a full spectrum hemp extract, versus instead of, you may not need it every day if you've got a younger dog. If we're talking specifically about joint pain, but in those moments where that there's going to be inflammation as a result of something, it can be a really good option to work preventatively.
Right. So I have I just had a conversation with my team about this today, right? And I have a Western practice, right? I have Western trained doctors and they have Western trained medical minds, right? And slowly but surely over time, like as we find new friends and we get new education and we improve our scope around wellness, right? Wellness has nothing to do with flea and tick preventatives or heartworm preventatives or vaccinations. In certain places, those may be important, right? And relevant to the animal's future and health, right? But nutrition is really where it all starts, right? And so to your point, and what you had said before about nutrition, I see it as in there is core nutrition, and then I see like more individualized nutrition, right? Because
absolutely
that little puggy and the difference from like, I don't know, I know some other breed that might not have genetic predispositions to joint related issues. If I knew that I had a pug, I am going to adjust my dog's nutritional profile earlier in life. I just had a physical exam with a 11-year-old King Charles Cavalier, right? Who, of course, has heart disease, and because that's genetically predisposed inside of that breed. And had that dog, been had we introduced omega fatty acids earlier into its life, had we introduced coenzyme Q10, L-carnitine, right? Certain nutrient additives that have been proven to be beneficial to that organ system, we could have probably warded off that dog's progression of disease far sooner.
Right.
When it comes to the joints, it's the same way. If we live an anti-inflammatory lifestyle earlier in life, we will have less problems progress, or they will just progress later down the road, right? So
one thing that I found was so interesting about, it applies really directly to this topic. If you want your animal to be kind of, if you want to be proactive about something to do with joint health, you can kind of look at the pieces of the joints that get messed up and look at feeding them those things, like the things that are good for the joints are, body parts from animals like trachea, like things that have a lot of cartilage in them,
like for their chondroitin source.
So beef trachea and chicken feet and different things that have these kind of like bony cartilage kind of building blocks that then your animal has. Bone broth is something that's got a ton of natural sources that can help bolster your pet's ability to not only build those joints and ligaments in the first place, but to repair them and recover them afterwards.
Or things like the green lip mussel.
Green lip mussel. Yeah. What are the fatty acids that are in there? There's like a few different really unique compounds that are in.
I mean, the most recognized is probably eicosanotetranoic acid, or ETA. Eicosanotetranoic acid. It's if I say omega fatty acids, you'll say fish oil, and then I'll say, well, what does fish oil have? You're going to say EPA and DHA, right? Because that's just what's plastered out there. Eicosanotetranoic acid is this really unique fatty acid that has been shown to be a super potent anti-inflammatory, but much less quantity of that fatty acid. So what's interesting about that particular raw material is that it always goes back to the story, right? This story about that particular raw material dated back to NASA looking for superfoods and them finding these indigenous people, the Maori people, who were consuming lots of mussels. But what they didn't realize is that they were not steaming them, right, to eat them. When you steam them, you lose the fatty acids. So these indigenous people had really low incidences of heart disease, rheumatoid arthritis, and osteoarthritis. What they found was that was because that fatty acid was in there, but they weren't getting the results that they wanted, because how do you open a mussel? You steam it. You can do it through heat. And fatty acids are super fragile. So when they finally figured out that the fatty acid was like the crown jewel inside of it, the whole industry started to blossom. And, I'm super passionate about that raw material for multiple sources. One, it's super clean. It comes from a super clean part of the world, right? This is way down on the earth.
Right?
Yep. Not around a lot of like commerce trade. So it has like these incredible like bays where they do these long line, aquaculture where they grow them. It is one of the most biosustainable raw materials that's out there. It's it's got a lot of recognition for how good it is for the planet, but it also is just an incredible jewel because it's a source of chondroitin, a source of these omega fatty acids. So it is, to your point, you can find these super rich, natural foods that are out there.
So cool.
That are beneficial. Yeah.
Yeah. These are green lip mussels.
Green lip mussels. Yeah.
Wow. Very cool.
So we have, that's what we have, Flexerna. That's our green lip mussel that we also have combined it on a 1-to-1 basis with MSM, which is methyl sulfotamethane, which is a source of organic sulfur. Most people only see MSM. It's literally in every joint supplement, but it's like the tertiary ingredient that's in there. But, we also then put that, extracted the mussel oil. So this has 10 times the concentration that the powder has of that oil because it's just been extracted. So I use those two things together.
Cool. Very cool. And that's got, like we were talking about, that's got a high concentration of MSM, much more than, there's a lot that you can do about adding leafy greens into your pet's diet, especially, from an early age that are going to have a lot of those naturally occurring sulfates in them, which is basically what MSM is.
It's just the organic sulfur molecule. It's like 34% organic sulfur. It's fascinating where that actually comes into play. This particular molecule is comes out of the death of phytoplankton, right? So plankton, and off-gassing,
like prehistoric phytoplankton, right?
Yes, and
so
then
all the MSM is from dead stuff, right?
Well, MSM is synthetically made now. It's synthetically made. You cannot extract MSM from the environment because it's at such minute doses. So it is all synthetically made, but it's made in the exact chemical reaction that happens in the atmosphere and then falls to the earth. We get it because we consume animals that have either eaten leafy greens, or we eat the leafy greens ourselves,
Right. Cool. Cool. So we've talked about a lot of different foods. We've talked about ways to manage pain, ways to spot it. We were going to talk about
No, go ahead.
No, please.
I was just going to talk about like what I think is important is the life cycle of that joint management and what that should look like for the parent, right? So I want to talk about it just from the sense of, we talked about a proactive approach versus a reactive approach, right? So the earlier you get in front of it and the earlier that you start to address that inflammation, whether it's through, whole food diet or it's through supplemental nutrition, however that is, the earlier you're aware of it and on it, the better it is, right? We talked about the early identification of it. Let's talk about just how the Western medical community would treat arthritic pain, right? Because
it's completely reactionary, and it's in most cases, I think people are kind of fed up because the things that it does is just masking symptoms. It's killing the pain and suppressing inflammation in a really unsustainable way.
They're going to hedge on non-steroidal anti-inflammatories, right? They're just going to hedge on non-steroidals. Interestingly enough, we just go back to MSM, right? There's maintenance doses of MSM and then there's therapeutic MSM, right? Therapeutic doses. So you could take that one raw material and you can push it, right, to get more out of it in terms of its anti-inflammatory characteristics or properties, just by adding more into the diet. But they're going to go to non-steroidal anti-inflammatories. Following that, they're going to go to gabapentin or tramadol, right? Gabapentin and tramadol. So, and that's going to get into like neuropain, management and opioid management. Tramadol used to be all the rage, 10 years ago, and it's kind of fallen out of vogue because it doesn't last in the body as long. but it still
Right.
can be a useful tool. For you and I, right, it's different, right? Because this is where like we're going to look about what are other raw materials that I can add into my life. What about curcumin, right? What
Hmm.
about
Yeah.
like
Yeah.
curcuminoids?
This is so. We have a study about curcumin, well, about turmeric and frankincense specifically, and
Right.
we talk about them a lot because that's what's in our Ease tincture, and they did this study at Baylor where they studied the anti-inflammatory effects of both of these two raw materials and found a really positive benefit for arthritis and for inflammation, and even greater effects when they were put together.
Right.
The curcumin, the kind of active ingredient in the turmeric, combined oftentimes with other elements, it sort of unlocks it. People always talk about adding black pepper to curcumin in order to sort of increase its potency and
Bioavailability.
availability.
Yeah.
Yeah, yeah. And frankincense appears to be one of those things, and so that's part of the reason why we have those two together in our Ease tincture, which
Yeah.
is what we use specifically for arthritis and joint pain.
Yeah.
So
We
that's
love that.
yeah, it's turmeric is kind of an incredible plant. It does a lot of things. I mean, I like that little infographic also talked about its anti-cancerous effect. So much of it all comes back to the inflammatory response and modulating that response.
Right.
One thing that Angela, our founder, she always talks about is like you can trace almost every disease back to inflammation. They all, you follow the line, and at the root you're like, oh, inflammation.
Yes.
And not that inflammation and that response is not a valuable thing that the body should do from
And
time to
it has
time,
its
but
time and yeah.
it's got a time and place. But we live in a time in a world where it has, because of so much of what is around us and our lifestyles and nutrition and exposure to different things, it can get out of control.
Yeah. So everybody's got to look towards leveraging those things. I like to use the word tweaking around this, Carter, because there is, I think as a society, sometimes we want just one solution, right? But we're looking for just one pill or one solution. And let's just say, let's say your dog was on a joint supplement, right? And you noticed, let's say you got it when it was like a moderate case of arthritis. You were a great parent. You picked it up kind of early, and the dog was doing well for years. And then the dog starts to slowly re-show you the signs of pain, the silent signs of pain. This is where you then tweak it, right?
Yeah.
You have to have open eyes and constantly be watching him to say, okay, well, it looks like it's not quite working as well as it used to. Do I then bag it and get rid of it? Hell no. You don't get rid of it. You need to add to it. So I really like these concepts of like boosting, right?
Yes.
So in some scenarios, like we have a combination product called Glycinate HA, super popular product. I just got a question from somebody. The dog doesn't seem to work quite as well as it once did, right? It was amazing at one point. Now it's just not working. What should I do, right? Boost it. So let's possibly boost the MSM, right? Because I have a lot of flexibility in that dosing because it's an incredibly safe raw material, right? 2, I could also just add in something like Flexerna, that omega fatty acid. I could add in the Ease product now. Eventually, maybe at some point in time, that itself is not doing everything. Let's say the dog gets up to 15. Maybe the dog would benefit from being on like a low dose gabapentin. There's nothing wrong with gabapentin. It's a great drug. It's a valuable tool at the right time. What we don't want to do is get the dog onto an NSAID when it's 5 or 7 or 9 right?
Mm-hmm.
That's not when we should be leveraging that kind of a tool, right?
Mm-hmm.
I would talk about, like, for example, the weekend warrior syndrome. Like, weekend warrior syndrome. This was the classic way that dogs will blow their ACL, right? So sorry about that little beep. ACL tears, number one orthopedic injury in dogs, right?
Mm-hmm.
Siri is listening to me. Stop
She's
talking.
listening.
Can't use her name. That evil little computer woman. If I go, so weekend warrior syndrome, orthopedic injuries with ACL tears. The dogs that, like, most people live a two-family lifestyle, right? Where they are two-family work lifestyle. They both are out working. The dog is sitting around the house. The dog maybe is a little bit out of shape. It's a beautiful fall day, right? I'm a dog. Everybody's out in the yard doing yard work. Oh, I'm going to go get that squirrel. They have been not conditioned. They go out, they hyperextend, they blow the knee out, right?
Right.
So sometimes, for me, if I relate this back to my knees before I go out to ski, I will load up on my anti-inflammatories, my natural anti-inflammatories beforehand, before the problem is a problem, right? Just to tie that back in. So you gotta pay attention
and warm up the joints too.
And warm them up.
It doesn't always have to be about what goes in. We have to think about what the actual physical work of these joints is, and to something that you brought up earlier is not over exercising too. Like you were talking about in puppies. People have that impetus. Can you talk about that a little bit?
Yeah, so this was just around, in the 20 years that I've been practicing, there was this change in methodology, in terms of how do we protect a puppy's joints so that we give them the best fighting chance. So let's just say, like, we don't have total control over genetics, right? Yep. I see this puppy, it's beautiful. Maybe it's not OFA certified, because I didn't get it from an OFA, a breeder that sees that as an important thing, and I just fell in love with it. I can't control the genetics, right? That's set and done, unless I'm the breeder, right? The second thing for puppies became, when do we neuter or spay the dogs? Through retrospective studies and looking at this, it was identified that the longer we wait, right, to spay or neuter them. We used to do this at 6 months of age, spay or neuter the dogs, right? Now we're talking about, like, ovary-sparing hysterectomies, right? So leaving the ovaries so that they can actually still have those sex hormones throughout their life. And there's pros and cons to that, and there's conversations going around. But we at least know that if we wait, till all the growth plates are closed, we're going to give them the best fighting chance. Overnutrition, right? People, so many of them, I don't know where the dog nutrition, I'm going to say the dog dry food nutrition world got all of their calculations. But if every dog that I've ever seen,
I don't know. I think that's a great question, and I don't think that there's a really great answer for it.
Yes, but it's wrong. It is
whatever it is
wrong. So overnutrition, getting these dogs to grow too fast, right? And getting them too plump too fast, right? Is not
your puppy
good
formula
for their
that's super high calorie.
Right. And then overexercise, right? Overexercise. If you were a runner and you wanted to get a dog, right, to run with, do not run that dog when it's a puppy. If you're running 3 or 5 miles, that dog is not ready to do it. Carter, I'm going to just use a perfect example. I am totally guilty of this. He was 6 when I figured this out. I go up to the mountains a lot. We're a hiking family. My son was 6 years old. He is complaining as we're going up the hill. And I'm like, keep going, keep going. I finally said to my wife, oh my God, look at me. What am I doing? Why am I pushing him? This is crazy. So this makes no sense.
When you would tell your clients not to push your puppies.
Yeah, he's telling me
your own puppy.
My little body is not ready for this, right? So very quickly when I figured it out, I was like, buddy, get on my back, because dad would love the extra, 25 or 30 pounds that you got. I'm ready to go, right?
Wow.
So just a tie-in. It's, it seems like it's common sense, but we sometimes don't have it.
Mm-hmm. Yeah. That makes a lot of sense. That makes a lot of sense.
So there's a lot of the things that these parents, can do. And it's impressive that they are as proactive as they are, just getting on and spending the time with us. Right. So now hopefully that they can go out and empower their friends. Right. And as they start to look and evaluate their four-legged kiddos, right, and start to be little ambassadors for just being good parents, right?
Absolutely. Once you know better, you do better. Yep. It's all about the access to the information and spread the word when you have other people ask you about this stuff. We have a love for educating on this subject. How do people find you? Is Top Dog Health the best way to find you?
Yep. So our website is www.topdoghealth.com. We set up a promo code, Carter, for your community or anybody that wants. They can just, if they ever want to buy green lip mussel or green lip mussel oil, or they want to ask us questions, feel free to ask us. The promo code is CBD Dog Health. It's a 20% if they want to try anything. Everything, as I'm sure is in your world, we guarantee everything. I honestly feel this way. If I am not a positive influence on your dog's life, then I don't want you to pay for the products, right? I'll give you your money back. I have no qualms about doing it. I just want to help them, right?
Yeah, totally. That's really awesome. Thank you so much. And I've got just one more kind of like image that I want to show. So this is one of the, I've been showing some images from our arthritis ebook, which we will post here. And this is just,
I read that,
some of the things that it's kind of it goes through a lot of the things that we talked about here today. What arthritis is, what causes it, what are some proactive ways that you can prevent it, and then different natural therapies and uninvasive different kind of remedies and therapies that you can go through that will help your dog. Some of the things we mentioned here, like cold laser therapy, chiropractic work, the underwater treadmill. There's a lot that you can do before you have to turn to NSAIDs and some of these drugs that are going to not really do much to actually help these joints. They're just going to kind of mask the symptoms and cause a lot of other problems.
For sure. And please, like the canine rehab community, it has grown so tremendously, over the last decade. And these services are now available to most people unless you live pretty remotely, and it doesn't always have to be at the end of the day that sometimes it's just valuable to go in, get an evaluation, talk to them, get home exercises. Carter, there's so many exercises that you can incorporate into the daily life, right? That will build the muscles that support those hip joints, right? Improve the elasticity and flexibility inside of that knee joint, right? That makes it more comfortable.
Right.
Heating, massage, there's a ton of different free therapies that you could do as a parent,
Awesome.
Yeah.
So cool.
Cool.
All right.
Carter.
Well, thank you so much, James. Thank you for joining us. Thank you, everybody out there. Did we ask any questions?
Yeah. I think we answered Marianne's question, and then there was.
I think so. Marianne, do you feel satisfied? Have we done a good job? Oh, Tracy says, any thoughts on comfrey? So comfrey is an herb that's known for its help with wound care and anti-inflammation.
I don't know anything about
Is
that, but I'm going to research it. I don't know anything about it. I'm going to write it down.
I know it more for oftentimes topical use on like ulcers. I guess it's also good for the stomach, for like stomach ulcers.
Do you know what it comes
I'm
from?
not sure.
I don't know. Oh, so sorry,
native,
Tracy.
It's like all over the place. It's from all over. It's like North America, Asia. I think it's kind of ubiquitous. It's if I'm correct. Tracy's somebody who has a lot of knowledge about herbs and minerals too. So I'm not sure about that for
Tracy,
arthritis.
send me an email about, you can email me at info@topdoghealth.com or drj@topdoghealth about comfrey, and I would be happy to learn more, and add any insight if I can.
Anti-inflammation, she says.
Okay.
Cool. I'm just checking in here. Laser, acupuncture, CBD oil. Yep. Yeah, I think we got it all, James.
Okay, cool. Appreciate your time today, Carter.
You too. Thank you so much for coming on here and sharing all your wonderful knowledge with us. Really appreciate it.
Yeah, I've always enjoyed learning all of your wisdom that you have endowed on me. So, and it's just opens the chapter. So I appreciate how you show up, my friend.
My pleasure. It's what I love to do. And thank you all of you guys for joining us today.
Thank you, everybody.
We'll see you on here again very soon.
All right, take care.
Goodbye.